You ready? Okay. Well, thank you for being here today. And thank you all for being here to help get us make sure that we are giving out life-saving information and resources to parents across the entire state. We shouldn't have to be doing this here today. But last week's harmful decision by Governor DeSantis and his health department to not pre-order COVID-19 vaccines for ages 5 and under created chaos and confusion. Unfortunately, it was just one more anti-science, dangerous COVID denialism from the governor and the Surgeon General who are playing politics with the health of our kids once again. Not only is the Florida Department of Health recommending against COVID vaccines for our kids, against all mainstream public health guidance, the governor is trying to take away parents' rights and access to vaccines to protect their children. Florida was the only state to not pre-order vaccines for 5 and under, a decision impacting high-risk children, parents, and our underserved communities the most. Parents who have been waiting long enough for vaccine authorizations for their young children. And I am hearing those heartbreaking stories all across our state, with families struggling and have been struggling to endure over the past 3 years with vulnerable children at home, and the hope they felt when a vaccine finally had been put out as available. Now, due to this failure by the DeSantis administration and the confusion created by this dangerous decision, Florida will likely see some delays in receiving doses as the federal government is once again having to step up to fill the governor's leadership void. This is part of a continued and concerted effort by the governor and his anti-science Surgeon General to push dangerous conspiracy theories over proven public health measures in an attempt to take away parents' rights to make their own decisions about their children's health from their doctors. This entire ordeal appears to have been intentional in an attempt to create chaos and confusion in the hopes of discouraging parents from accessing vaccines, making it appear as if there would be no dosages available here in the state. So I'm here today to set the record straight and provide parents with the information that the DeSantis administration won't share. This weekend, the CDC issued its final recommendation and formal recommendation following a vote of unanimous support by its advisory committee that all ages 6 months to 5 years should receive a vaccine, including children who have already had COVID-19. This follows Friday's authorization by the FDA for both Pfizer and Moderna vaccines for young children, clearing the way for the vaccines to be administered as early as this week and expanding eligibility to vaccination to nearly 20 million additional children across the United States. Parents and caregivers can now get their children vaccinated ages 6 months to 17 years of age, vaccinated with Moderna's vaccine or the Pfizer vaccine for children ages 6 months to 4 years to better protect from COVID-19. COVID vaccines have undergone and will continue to undergo the most intensive safety monitoring in U.S. history. While Florida was the only state in the nation to not pre-order these shots, and Governor DeSantis has said that they won't be made available by the state, distribution by pediatric vaccinations for these younger children will still be available across the entire state, as state pediatricians and healthcare providers can now order these newly authorized vaccines directly from the federal government. Florida vaccine locations will include pediatric practices, federally qualified health centers, and pharmacies, including major retail chains that have partnered with the federal government to provide these vital vaccines, like Costco, CVS, Harris Teeter, Kroger, Publix, Sam's Club, Walgreens, Walmart, and Winn-Dixie. Parents can reach out to their doctor, nurse, local pharmacy, or visit vaccines.gov, which we have also shared on our FDACS website, which is fdacs.gov, to see where vaccines for children are available nearest to them. So again, that's vaccines.gov, and at the state level on our website, fdacs.gov. Sharing this information and providing access is about supporting parental rights and individual freedoms, which the governor claims to be a champion of. Yet he's taking away these rights. He's taking away the freedom to make a decision for your own family. He's actively blocking access to these choices. So while I still hope that the governor will do the right thing and make these vaccines available at Florida's local health departments, unfortunately, I'm not optimistic. That is why it is so critical that we speak to all of our parents and let them know that vaccines will still be widely available in Florida and where to find federally supported vaccination locations across the state. Knowledge is power. By sharing this life-saving information, we are protecting parental rights, we are protecting individual freedoms, and most importantly, we're protecting our children from COVID-19. So thank you for your time, and certainly we'll answer questions.
You've been in contact with all these major retailers. Do you have any specific information on dates or when will they have the vaccines available?
So unfortunately, because the fact that we've been in constant communication with the White House, who has been giving us up-to-date information of when the vaccines from the federal government are going to be shipped down. Again, we are all hoping that this week that the vaccines will be available at all these locations. But unfortunately, because the vaccines were not pre-ordered, there's going to potentially be a little bit of a delay, which is why it's important to go on to those two websites to find the information to see when they're available. And it's going to depend on regionality. In fact, I was on talking to a parent earlier today who tried to reach out to Orlando Health, and they said that those vaccines won't be available at Orlando Health until August. So this is what is happening because of the chaos and the confusion and the governor pushing his own agenda, that a lot of these parents who have waited so long may have to wait a little bit longer because of the order not coming in as fast. But we're monitoring, we're pushing it. Hopefully some of these locations that we've talked about, federal locations, will be able to get these vaccines hopefully in a very short period of time.
Commissioner, you said we are in discussions with the White House and monitoring. You're referring to your office at
Yes.
the Department of Agriculture and Consumer Services?
Yes.
Is there a traditional role for the Commissioner of Agriculture and Consumer Services to be playing here, or are you sort of stepping out a little bit further than perhaps some of the other cabinet members of this?
You know, look, this international worldwide pandemic is certainly nothing that any leader has ever had to deal with in the country. And so certainly underneath my explicit purview as a Commissioner of Agriculture, we don't oversee health. We don't oversee some of these emergency management operations that are here in the state of Florida. So what we are doing is providing information. And so that way, because the governor has been void on this leadership and has been void on giving this information out, in my official capacity as a statewide elected member of the Florida cabinet, we are here to provide access, and we're the only ones who are talking to the White House to make sure that this information is given out to the people of our state.
Some things that the governor has not done, at least certainly not in a long time, is advocate for the safety or effectiveness or public safety, public health needs for vaccines. Are you ready to make some statements along those lines today?
Look, I'm not a doctor. I'm definitely not an expert when it comes to vaccines. That's why we have healthcare experts. That's why we have the FDA. That's why we have the CDC. My job as an elected official across the, statewide elected, is to be up here providing information. That's why it's important for parents to get this information, do their research, know that medical experts across the country are supporting children getting vaccine and 6 months and older. And so it's my job to say, listen, these are the facts as I know them. This is the information that I have been given from the people that I'm in communication with the White House. But it's important for the parents to do their own research, they know their children best. They know what their allergies are. They certainly know if they've been having any adverse reaction to any previous vaccines. And you should also know if your children are in school or if they're being homeschooled, to know what their risk level is, and talk to your healthcare experts, talk to your physicians, and make sure that you're creating an informed decision. My job is to provide information and then letting the parents decide what is best for them. It is not my job to recommend to be vaccinated or to not to be vaccinated. I just give out the facts.
Commissioner, when we rolled out the vaccine, the governor relied heavily on Walgreens and CVS, and that was championed as a good idea. why is it not a good idea today? The state's been out of the vaccine process, or at least vaccine sites, for months.
They still have the vaccines at the departments of health, so local departments of health. And that's where the big problem is here, is that so many in our underserved communities may not have a primary doctor or a physician or have even health care insurance. And so the local health department is where so many of our families go to for vaccines and for healthcare advice. And to not provide it in these areas, in these locations, it is a big problem. And even when the governor was putting out these vaccines originally at pop-up locations, let's also not forget that when the vaccines were first put out, there was pop-up locations over our state. I criticized that where those locations were. Also, the concern was that they were only at Publixes at the beginning, which we know that we've got 3.5 million Floridians that are food insecure, that don't have access to transportation to have gotten to some of those facilities, which is why it was really important to put up some of those pop-up locations in more of these underserved communities and more of our minority communities, which is what my push is today, that even some of these locations still could potentially be a hindrance for getting this information out and getting these vaccines to those locations. And again, this is a new program for our children, and we should be doing everything possible to get these vaccines out and to make sure that they're getting put into locations that provide access to those that are underserved.
Did you have a chance to read the New Yorker's profile on the governor?
I didn't, but I did watch Morning Joe this morning, and the writer was on Morning Joe, so got to hear a little bit of his commentary on it, but I haven't had a chance to read it.
I looked at some of the numbers this morning on the CDC on vaccination rates. Florida is generally in the middle of the pack among the 50 states. A little lower for elementary school vaccine. So kids that are 5 to 11. I think we were, I don't remember exactly, the 35th, I think, nationally on that. Do you think these numbers need to be brought up? Is this a matter of, parent choice out there, or does this reflect more of lack of knowledge?
Look, I think it's a combination of both. The problem is that you've had a governor who at the very beginning was pushing vaccines, and then because he felt that it was not politically astute of him to be pushing vaccines, that he backed away, stopped providing state resources, stopped having press conferences giving out information. And so when you don't have information and don't see your leaders stepping up and saying, look, we are in a healthcare crisis, and now we're in the endemic phase, and of course we don't want this to be back into a pandemic phase, which means everybody has to take personal responsibility. We've all been through this now for almost 2 years at this point, a year and a half. And so it's really important that everybody is starting to really focus on 2 years, start to focus on getting the information and making sure that they're doing what's best for their family members. But when you have leaders like Ron DeSantis, who comes up here and says, we do not encourage it, won't have even an honest conversation about what he has done personally to show leadership to step up, I think that a lot of people have taken a step back and are unwilling to get the vaccine because, well, if our governor says it doesn't matter, then why does it matter? And instead say, look, I'm here to provide information, resources, and asking people to do what they feel is in the best interest for themselves, for their employees, for their business community, and because, look, we were all in this together, and the only way that we're going to get through this is together. All right. Awesome. Thank you.